Hey, all you cool cats and kittens out there. My name is Ashley Burns, and I'm a senior nursing student at Fayetteville Technical Community College. Today, we are going to be going over my capstone project, which was on HIV and AIDS infection. We're going to look at a case study for a patient that has just found out that they're been diagnosed with HIV. We're also going to look at the care plan that would be for that patient. Some of the goals, the learning outcomes that we have for today are going to be for the nurse to be able to educate the patient on risk factors and signs and symptoms of infection. We're going to talk about treatment options for the disease because HIV is not curable, but it is definitely treatable. And we are going to learn about the special considerations that nurses may need to make for the emotional well-being and emotional support for both the patient and the caregiver or family. And towards the end, we're going to have a little quiz so that you can test your knowledge. And why don't we get started? Let's begin with a brief history of HIV and AIDS. The human immunodeficiency virus, or HIV, is a virus that can be spread through contact with contaminated body fluids. The first confirmed case was an African male in 1959. It is believed that the virus made the jump from a primate, specifically a chimpanzee, to humans through contact with the blood or the brain of an infected chimpanzee. In the 1980s, cases of a rare type of pneumonia called PCP pneumonia began to surface in major cities in the United States, mainly among populations of gay males. Around 1982, there were other vulnerable populations that were identified, and they were known as the 4-H Club. These were homosexuals, heroin users, hemophiliacs, and Haitians. HIV and AIDS do not discriminate. They can affect anyone from any walk of life. Although some populations are at higher risk, and they include gay and bisexual males, people of African American or Hispanic or Latino descent, and those individuals that are transgender and IV drug users. Currently, gay and bisexual males have the highest rate of new infections in America. Studies show that socioeconomic status has a profound link to HIV infection rates. People with lower financial means and lower education have a higher instance of risky lifestyle choices. People in this group also have a lower chance of access to testing and health care. This is our case study. Our patient's name is Ura Snotball. He is a 40-year-old male. He comes to his primary care office stating that he feels like he has the flu. He says, "I've been feeling bad for weeks. I'm tired, my body hurts, I have headaches every day, and I've had a fever on and off." His vital signs include blood pressure 132/88, heart rate 82, respiratory rate is 20, and his temperature taken orally was 102.6. His O2 sats are currently 96%. He denies any allergies or drug use and other medical conditions. The patient states that he is married with a teenage son, he works at a bank, and he goes to the gym a few times a week. The nurse asks about his sexual activity, and she notes that he stammers, wrings his hands, looks at the ground as he explains that he has a sexual relationship with his wife, but he recently started an affair with a man that he met at the gym, and that they usually use condoms. Other assessment findings were within normal limits, with the exception of some enlarged lymph nodes in the neck and the axilla bilaterally. Mr. Snotball's doctor ordered a rapid flu test, which came back negative. The physician also ordered a CBC to be drawn, or a complete blood count. Here are the results. On the left side, we have the normal values, and on the right side, we have Mr. Snotball's lab values. We can see that his red blood cell count is lower than normal at 3.75, and his hemoglobin and hematocrit are both slightly decreased, hemoglobin being 111 and hematocrit being 33.3%, which would indicate he has possibly some anemia going on. His white blood cell count is high at 12,800, and platelets are 120,000, which are low. Also, his CD4 count is low. It's 300. Usually, a CD4 count of under 200 would indicate progression to AIDS. So that's definitely something that his doctor is going to want to investigate. Let's break down these lab results a little bit further. So explain why the WBC and CD4 count would be relevant to an HIV diagnosis. The high white blood cell count indicates that the body is actively trying to fight an infection, while the decrease in number of the CD4 cells indicates that there's some damage to the immune system that is consistent with HIV infection. Again, usually if the CD4 count is below 200, that's indicative of progression to AIDS instead of HIV. We're going to look at the RBC, the hemoglobin and hematocrit and platelet counts included in the CBC. So the low red blood cells, low hemoglobin, and low hematocrit all point to anemia of some fashion, and anemia is a common condition that accompanies HIV, which could also explain in itself just the anemia, some of his symptomology, the feeling weak, the just kind of feeling run down. But we'll go on to some further testing that's needed in the next slide. After reviewing the results of his blood work, the physician asked the nurse to accompany him to speak with Mr. Snotball. The physician explains that the symptoms and history that he has presented points to needing an HIV test. So Mr. Snotball asked how this test will be performed. Which way should the nurse answer? A blood test, a sonogram, an x-ray, or skin sample? Of course, the answer is A. We need a blood test. That's the most common way to rule out HIV or to diagnose HIV. The nurse explains that a blood sample will be taken and an NAT or nucleic acid test will be performed. This type of test looks at the actual HIV in the blood, along with the viral load or how much of the virus is present in the blood, and that gives us an indication of his overall health. Although this type of testing is more expensive, it's preferred because of his high-risk sexual contact. Mr. Snotball asks how long it will take for these test results to come back. What's the most appropriate answer? Instantly, a few days, a month, 12 hours. The answer is B. This type of testing can take a few days to come back, up to a week. But it is, again, the most reliable, kind of the gold standard, if you will, for testing when an individual has had high-risk contact, such as Mr. Snotball with Mr. Snotball consents to testing, and the nurse draws his blood. He is educated about the need for barrier protection methods that should be used during sexual contact. 4 days later, Mr. Snotball receives a call from his physician's office asking him to return to discuss his test results. The physician explains that his initial test was positive and a follow-up test is needed to confirm the findings. A second test confirms that Mr. Snotball is positive for HIV. Mr. Snotball asks if he could have given this virus to his wife. What is the best response by the nurse? Of course you could have given it to her, you selfish man. Have you had unprotected sex with her in the time since you started having an affair? I'm almost certain that you gave it to her because the disease is spread by close contact. Or, if she's touched your belongings, she probably has it too. Of course, our answer is B. And it is B because if he's had unprotected sex with his wife in the time that he has been having an affair, and unprotected sex with the man that he's met, there's a possibility that he could have potentially passed this virus to his wife, since we know that HIV is passed through contaminated bodily fluids like semen, blood, other bodily fluids like that. After the results, the physician explains that he needs to share his status with both his wife and anyone else that he has had sexual contact with. Mr. Snotball sits in silence and begins to cry. What is the best action taken by the physician? Sit with him and allow him to cry. Ask him if he understands what he has been told. Hand him a prescription and leave the room. The answer is A. Mr. Snotball is likely experiencing some grief and guilt, and it's best to give him time to process the information he's been handed before any further action is taken. When patients are in a state of heightened emotional response to bad news, especially, they're not going to be able to process any additional information that we're going to give them. So it's good at this point to give him a few minutes, let him absorb that information, and then we can move on to what our next steps are. So after a few moments, Mr. Snotball asks what needs to happen. The nurse gives him some information about HIV, how to prevent the spread, treatment options, and support groups. The physician explains the role of medication in preventing him from becoming sicker. And together they decide on a new medication that treats HIV with one pill. It's called Biktarvy. This medication works in what way? It kills the virus and cures the patient. It manages the symptoms only. One pill contains 3 types of medicines to lower the amount of HIV present in the blood. Or D, the medication causes increased elimination, resulting in the virus being excreted through stools. The answer is C. Biktarvy is a type of medication that has 3 different medicines in one pill to reduce the amount of HIV present in the blood, which will reduce the chance of spreading it to other people, and it will also reduce his symptoms. HIV cannot be cured, it can be treated. And of course, this medicine does not make you excrete HIV through your stools. 2 days pass, and Mr. Snotball returns to the office with his wife. She requests to be tested as well. She is clearly very upset, and she tells the nurse, "I can't believe he would do this to me. I can't believe that I probably have AIDS, and I'll probably die before I ever have grandchildren." The nurse realizes that Mrs. Snotball is grieving. What's the best response to her statement? Oh, men are just pigs. You didn't have any indication he was cheating? HIV is treatable, and with all the advances in medications to treat it, you can still have a long life even if you contracted the virus. I'll give you the name of a good lawyer. The answer is C. Mrs. Snotball doesn't seem to understand the difference between HIV and AIDS, and the best action right now is to explain that she doesn't necessarily have a death sentence because of this disease. Mr. and Mrs. Snotball began attending a support group for HIV patients that is hosted at a nearby community center. Mrs. Snotball's test results come back, and she is negative for HIV. Their relationship is strained, and they currently see a marriage counselor to work through the difficulties caused by Mr. Snotball's infidelity. What additional education would the nurse provide on preventing HIV infection for Mrs. Snotball? Select all that apply. Condom use, starting on PrEP, frequent testing, increasing calcium intake, not sharing eating utensils, sleeping in separate beds. The answer is A, B, and C. The rationale. A, B, and C are all examples of how to prevent the spread of HIV. So let's look at the care plan for Mr. Snotball. One nursing diagnosis is infection risk 4. It's related to chronic illness. HIV is a chronic illness. He will have it for the rest of his life, even if his virus is at an undetectable amount. It's as evidenced by his immune system dysfunction. The goal for this patient is that he will remain free from opportunistic infections. And what interventions should we use to make sure that we reach that goal? We need to educate him on infection prevention. Things like hand washing, staying away from people that have illnesses. We also need to educate him on proper medication regimens to increase the CD4 count and decrease the HIV virus load in his blood. And we also need to teach him to observe and report any signs of infections. That could be fever, shortness of breath, changes in skin, looking for things like lymphoma, Kaposi sarcoma. The second nursing diagnosis we want to look at is fatigue. And that's going to be related to a physiological condition such as HIV, as evidenced by his chronic illness. The goal for this is that the patient will identify activities that cause worsening fatigue at the end of the teaching session. And what interventions will we use? We're going to evaluate his nutritional needs. Sometimes with HIV infection, either the virus, the process of the infection itself, or the treatment can make a person experience nausea, vomiting, diarrhea. If those are happening, if he's not able to bring in enough calories to meet his nutritional needs, that could make him experience fatigue. Things like anemia can make him experience fatigue. So we want to identify and treat any pathologic reasons for fatigue, like the anemia. And we need to assist him in finding support for his emotional needs. The nurse can accomplish that by referring him to a counselor, to a support group, making sure that he knows where he can turn for help. Third nursing diagnosis, family process interrupted, related to an alteration in the health status of a family member, as evidenced by the new medical diagnosis. The goal for this one is that the family will express their feelings related to the diagnosis, and interventions include acknowledge the feelings of the family. Let them express those feelings and acknowledge that they are valid. Establish a relationship between the healthcare providers, the family, and the patient. Make sure that there are pathways where the patient and the family know that they can talk to and trust those healthcare providers and be able to reach out to them when they need help. And also allow and encourage the family to participate in the care for the patient as much as they want to. You'll find that some family members really want to be hands-on in caring for the patient. Some family members would rather not be so hands-on, but be more vocal in expressing what they want to happen. This slide contains some community resources available specifically in Cumberland County. Cumberland County Department of Public Health provides testing, counseling, and treatment for HIV and other STDs. Testing and counseling are offered free of charge Monday through Friday from 8 a.m. to 5 p.m. Walk-ins are accepted, but appointments are preferred. The number is there on the screen if you would like more information. Planned Parenthood of Fayetteville, they provide a range of health services, including HIV testing and counseling, which can be done anonymously, and they do the rapid HIV test, which can give you same-day results. They are located on Yadkin Road, and the number is on the screen. We also have the Cape Fear Regional Bureau for Community Action Incorporated. They provide free and confidential testing for HIV and syphilis. The number is available on the screen. Community Health Intervention Sickle Cell Agency Incorporated provides free HIV, sickle cell, diabetes, glucose, and syphilis testing Monday through Friday, 8 a.m. to 5 p.m. And Lisa's House of Care Incorporated is an organization that provides transitional housing for women affected with HIV. They cater specifically to women, and this resource is for women that are trying to maybe get out of poverty, out of homelessness. They provide counseling and, again, the transitional housing. And the number is there on the screen if you're interested. Who's ready for a quiz? So, number 1. True or false? HIV can be cured with antibiotics. False. This is false because HIV has no known cure currently, but with proper treatment, the risk of complications and spreading the disease to others can be greatly reduced. Number 2, HIV is classified as a blank. Answer choices are a cancer, a type of virus, type of flu, or a biological weapon. HIV is classified as a blank. It is a type of virus. Number 3, what is a common cause of death in HIV patients? A, drug overdose. B, car crashes. C, heart failure. D, opportunistic infections. The answer is D. These type of infections are often not lethal in people with functioning immune systems. But for patients with HIV and immune dysfunction, these common infections can sometimes be deadly. Number 4, true or false? There is only one way to test for HIV. The answer is false. There are different types of tests that can be performed to test for HIV. You have blood samples, rapid HIV testing that uses cells from your cheek. There's a rapid little finger prick blood test. But ultimately, the NAT or nucleic acid test is the preferred method because it actually shows the amount of virus that's in the blood. And number 5, who can catch HIV? Select all that apply. A, gay males. B, bisexual males. C, straight women. D, preachers. E, congressmen. The answer is all of the above. You should have selected all of them Because remember, anyone can become infected with HIV. It is more prevalent in certain communities like gay and bisexual males, but it can affect anyone from any walk of life. Thank you so much for watching. I hope you learned a little something extra today that you can take on and work with in your practice as a nurse. Remember that if you know about HIV, you can protect yourself from HIV. So continue learning, never stop learning. And again, thank you.